My name's Evan Minerick. I'm an advanced clinical nurse at Hopkins Bayview in the emergency department. And it sounds silly. I started working here about 4 months before I started dating my wife. So I've had a longer relationship with this place than I have with the closest person in my life. What I like about the ED is that it's a bit like organized chaos. You never know what you're walking into every day, whether it's your assignment, whether you're going to be in triage or the trauma room, or have a 3 or 4 to 1 nursing assignment where you just get to do full patient care hands-on, or you can be the float nurse or the charge nurse and kind of get a variety of tasks. It's built-in teamwork, and everybody kind of knows what we're up against, so to help each other out with that teamwork to provide the best patient care that we can. So I started 13 years ago as a summer nurse extern. I stayed on as a patient care tech for the next year until I finished nursing school. And then when I finished nursing school and passed my NCLEX, I started as a new grad nurse in the emergency room here. At the 3-year mark, when I was able to apply for the ACE program, I did. I was already doing committee work and had passed my certified emergency nurse exam, and you also have to have a bachelor's degree, which I already had coming into the job, and got my manager's signature and was ready to go. So the ACE program is a leadership continuum, and leadership doesn't necessarily mean administrative. So there's the senior or the RN3, and there's the advanced or the RN4 within the ACE program. With the role that I have now, I have 1 shift every other week where I get to do education things, but it's nice to have that voice in the administrative setting and the educational setting. It was something designed for the high performers already, and if you're already doing that work in the committees and you're already getting your certification in your specialty, this is what that program is for, is to compensate those people and kind of retain them. So what's in it for the ACE nurse? First off is more money. You get that 5 or 10% increase, and it allows you room for growth, whether it's interacting with your department, your manager, your educator, or other departments. Allows you to participate with other ACE nurses, the higher performers in the hospital, to build those relationships, and gives you a seat at the table to work on those projects that matter to you. It allows you to remain mainly clinical, and I know most people go into nursing so they can be in the clinical space. You want to have hands-on patients and helping them the best you can. I would say that it's a pretty painless. The application's a bit of a bear, but it's really, if you just go down the checklist, it's not that bad. And it's nice to have that voice in the administrative setting and the educational setting. I think better colleagues is a good thing that makes the department better. It goes from the anterior to the posterior. The only thing that cost money throughout this entire process was the certification exam, and if you pass it, the hospital will pay for it as long as you have pre-approval from your manager. And so outside of that, it doesn't cost anything except your time to fill out the application and do the interview. All right, so good job. This person sat up and thanked you for saving their life.
Oh, awesome.
Wonderful
Good day.
work. Yeah, I would say that there's no one type of person that goes into the ACE program. I don't think anybody there has a singular goal in mind to climb the ladder and be the CEO of the hospital. I think that they just want to do what is passionate for them, and that's great. I don't think anybody should, want to be the same, and this program doesn't pigeonhole you into one track. And the balance of this role allows me to remain hourly, so that way when I do leave the hospital, I am leaving the hospital. I spend so much of my time indoors that when I have the opportunity to just go for a walk in the woods, that it's extremely freeing. It kind of keeps me right, and I am a better person when I'm out there. So I can't think of anywhere else I would rather work. I am a firm believer that the grass is greener where you water it.